Welcome to my father's show, ColdLaser.tv.
Okay, welcome. Today we are on location in Maryville, Illinois for a combined edition of Cold Laser TV and the Biomat show. And I am the guest host today. My name is Dr. Brian Reed, and I am going to be interviewing Dr. Todd Austin from Austin Family Chiropractic in Verdon, Illinois. So, Dr. Todd, I understand you do a lot of knee pain type of work in your clinic, typically osteoarthritis, maybe some Baker's cysts, maybe individuals who are, have surgery in their future and maybe want to postpone that a little bit. Can you share a little information about how you incorporate lasers and the Biomat with treating these type of conditions?
Sure, I'd be happy to, Dr. Reid. So, yes, I see a lot of knee pain in my clinic. It's really, honestly, one of the things I get excited about is seeing tough knee pain cases. We have a lot of chiropractors in the area that really focus more on spines, and they really don't have a whole lot to offer for knees. So that's one of the reasons that I just love working with knees with some of the light therapies that I do, including the cold lasers and Biomat. So we work with a lot of osteoarthritis or OA knee pain cases. A lot of them are bone on bone. A lot of them have maybe had the chicken cone or rooster cone injections and it didn't really do much. Some people told they don't need surgery or they're not a candidate. Others are told you do need surgery but they don't want it. Right now we're working with a young man with psoriatic arthritis of the knees, and we're having really good results with him with the cold lasers and Biomats. We work with Baker's cysts. I think I've worked and had good luck with like 8 of those in the last year, Baker's cysts. So,
okay, well, depending on the situation, for patients, how long does it take before they start to realize the benefits of care?
Okay, so when we were just doing cold lasers as our the main part of our treatment program, which I've been doing those going on 10 years, 85% of my patients for knee pain will feel an improvement within 3 to 4 hours of the first visit. Okay, that's the statistic. We started that in Biomat therapy 11 months ago. The Biomat therapy is that much quicker than the cold lasers. I'd say 97% of the people will realize some improvement within 20 minutes.
Right?
And I say 20 minutes because we normally put the person on the Biomat in our clinic for 20 minutes. So if it's a bilateral knee, we'll tend to wrap it over both knees. If it's just one knee, we tend to wrap it around and strap it around that knee. So that's how we're incorporating the Biomat.
Okay, so you're able to shorten that recovery time?
Yeah, so basically people are noticing very quickly that they're getting benefit.
Okay, great. Are there any other adjunctive therapies that you use along with the Biomat and laser?
I'm using, in some cases, depending, I will adjust the lower extremities, with chiropractic care. So we're talking adjusting the knees, adjusting the feet, the ankles, checking things and what needs adjusted, we adjust.
Okay.
Sometimes we're also adjusting the low back and the pelvis with that. Now, obviously, if their chiropractor refers them to me, we're not touching their spine. We're leaving that for their primary chiropractor. We're also using a couple of supplements that one that's good for anti-inflammation, one that's really good for joint health.
Okay,
So
like a glucosamine sulfate or chondroitin?
Yeah, we're incorporating a glucosamine sulfate / boswellia complex, and we're doing the high dose fish oils. So those are the two supplements that we're really big on with helping in what I call Dr. Todd's knee pain protocol.
Sure.
Those are the two supplements we'll use with that. So.
Okay, and about how many visits would a patient expect?
Typically, we're looking at 8 visits. And, so if let's say someone's referred by their chiropractor who he says, I don't treat knees, but you can have surgery, or why don't you go to Dr. Todd because he does cold lasers and Biomats for that. So I'll basically, depending on what I find, I'm normally recommend about 8 visits. Sometimes it might be 6, but it's typically 8. And we're gonna do the cold lasers each visit. We're gonna get them using the fish oil and the glucosamine sulfate boswellia. We're going to, like I said, adjust what I feel we need to adjust in the extremities. We're gonna do Biomat after the cold laser and adjustment each visit.
Okay, and how do you incorporate the biomat specifically?
Okay.
Do you wrap it, or do you just lay it on top, or?
I've
about how
done
long?
both. Yeah, I've done both, depending on what the person has going on. Like I said, if it's one knee or if it's a whole knee, or let's say they got Baker's on the back and they've got a medial collateral ligament and they've got a lateral collateral ligament, they got a few different things, we'd probably wrap it. But if it's just, let's say the front of the knees hurt, we might just, and there's both knees, we might just wrap it over both knees.
Mhm.
So if it's a single knee complaint, we're usually looking at 8 visits. If it's a two-sided issue, both knees, we're usually looking at 16 visits.
Okay,
But
now would the
that's-
patient need some maintenance care to maintain what the kind of work that you've done?
That's a
for
great
them?
question. It really depends. Some people will, follow up and come in about once a month for maintenance. I've had other people that I've done the 8 visits for one knee and released them, and 2 years later I run into them in the grocery store and say, "Oh my God, that knee's still doing great." But then lately, what I've been doing is if people are interested, if they're really convinced how awesome the Biomat is, a lot of times they'll wind up buying a Biomat before I've released them from care. So after say 8 visits, I release them and say, go back to your chiropractor. If you ever need me again, you know where to find me. And
So
a
I
lot
would
of
imagine the
times-
biomat pays for itself.
Yeah, a lot of times they're just buying a Biomat, and and that way they get to use it every single day, 7 days a week.
Mhm.
In 11 months we've sold 82 Biomats of the mini mats, and I've only talked to 2 people that are not using those every single day.
Is that right?
The other 80 people that are using them every single day.
Okay,
So,
wow, that's awesome.
which is pretty powerful.
That is powerful.
And part of my goal as a chiropractor is to empower my patients to basically take care of their own health and not be like dependent on me. I mean, I'm here for you if you need me, but I don't want you to have to be dependent on me for everything.
Right, going back to that whole doctor-teacher.
Exactly. Yeah,
Concept.
physician is not only a doctor but also a teacher.
Great. Well, that's great information, Dr. Todd. Thank you for being on the show.
Okay, thank you for hosting the show, Dr.
Yeah,
Reed.
it was
Appreciate
great.
it.
Thank you.